Scene script. Have you ever thought about the silent threats lurking within our bodies? One such threat is the aortic aneurysm. Let's delve into what this means. The aorta, the main highway for our blood, is a crucial part of our body's intricate network. An aortic aneurysm is an abnormal bulge in the wall of this main artery, a dangerous flaw in the system like a ticking time bomb waiting to explode. This bulge can rupture or split, leading to devastating consequences. Life-threatening internal bleeding or a blockage of blood flow, akin to a city grinding to a halt because of a major roadblock. The aortic aneurysm isn't picky about its location. It can occur in the thoracic area, that's your chest, or the abdominal area, your stomach. There's a slight difference between these two. Abdominal aneurysms are more common, especially in men and older individuals. It's like a silent enemy that chooses its battleground within our bodies. The aortic aneurysm is a master of disguise, often camouflaging itself as nothing at all. It's one of those conditions that often do not cause any symptoms until they rupture. This makes them even more dangerous as they can quietly grow and expand without any alarms going off. Imagine it like an invisible predator lurking in the depths, silently growing stronger and more dangerous, often going unnoticed until it strikes. This is the reality of an aortic aneurysm, an enemy within, silently waiting for the perfect moment to strike. The aortic aneurysm, a silent threat, often goes unnoticed until it's too late. Now that we know what an aortic aneurysm is, let's delve into who is more susceptible. In the realm of risk factors for aortic aneurysms, family history stands prominent. If your family tree has a history of aortic aneurysms, your chances of developing one increase. It's a silent reminder that our past can indeed influence our present health conditions. Next, we have smoking. The tendrils of smoke do not just harm your lungs, but extend their damaging reach to your aorta as well. Long-term smoking has been linked to the weakening of the aortic wall, making smokers more prone to aortic aneurysms. High blood pressure, too, is a significant risk factor. The relentless pressure exerted by the blood on the walls of the aorta can lead to the formation of aneurysms. It's like a relentless tide, wearing down the cliffside. Only in this case, the cliffside is your aorta. Certain genetic conditions also play a role in increasing the risk. Conditions like Marfan syndrome and Ehlers-Danlos syndrome are known to affect the body's connective tissues, including those in the aorta, making individuals with these conditions more susceptible to aortic aneurysms. Now, let's talk about two specific groups who are at a higher risk: men and older individuals. Abdominal aortic aneurysms specifically are more commonly seen in men. Age is another major risk factor. As we grow older, our bodies go through wear and tear, and our aorta is no exception. The risk of aortic aneurysms increases as we age, especially past the age of 60. However, it's important to note that while these factors increase the risk, they do not guarantee the development of an aortic aneurysm. They are pieces of the puzzle that, when combined, can create a clearer picture of your risk profile. Knowing the risk factors empowers us to take preventive measures and spot potential signs early on. Remember, knowledge is power, and in this case it could be the power to save a life. Aortic aneurysms are often silent, but certain symptoms can hint at their presence. Like a stealthy predator, an aortic aneurysm often lies in wait, showing no signs of its existence until it ruptures. The nature of this condition is what makes it particularly dangerous. Now, while the symptoms of an aortic aneurysm are often not noticeable until the aneurysm ruptures, there are times when signs might emerge. These symptoms can vary depending on the location of the aneurysm. If the aneurysm is in the chest or a thoracic aortic aneurysm, symptoms may include chest or upper back pain, hoarseness, trouble swallowing, or shortness of breath. On the other hand, an aneurysm in the abdomen, an abdominal aortic aneurysm, may cause a pulsating sensation near the navel, unexplained severe pain in the abdomen or lower back, or persistent cough. However, when an aortic aneurysm ruptures, the situation becomes a medical emergency. The symptoms of a rupture are typically sudden and severe. They may include intense and persistent abdominal or back pain spreading from the abdomen or back to the pelvis, legs or buttocks, clammy skin, dizziness, nausea and vomiting, rapid heart rate and shock. It's worth noting that these symptoms can also be associated with other conditions, so it's important not to jump to conclusions. However, if you or someone you know experiences these symptoms, particularly if they are severe or sudden, it's critical to seek medical attention immediately. Remember, aortic aneurysms are like ticking time bombs in the body. They can remain dormant for years, causing no symptoms, and then suddenly rupture, leading to life-threatening internal bleeding. Knowledge is power in situations like these. Understanding the potential signs and symptoms of an aortic aneurysm rupture could be the difference between life and death. Being aware of these symptoms could potentially save your life or the life of a loved one. So, let's not underestimate the power of awareness and vigilance. In the next scene, we will delve into the methods of diagnosis and detection of aortic aneurysms. Scene script. Wondering how doctors detect these hidden threats? Let's uncover the process. Aortic aneurysms, these hidden threats to our health, can be elusive to detect due to their lack of symptoms. However, medical professionals have a range of imaging tests at their disposal to identify these potentially dangerous bulges in the aorta. The primary tool used to detect an aortic aneurysm is an ultrasound, a non-invasive test that uses sound waves to create images of the inside of your body. It's often the first test doctors turn to, as it can quickly reveal if there's an abnormal enlargement in the aorta. However, while ultrasounds are effective in detecting aneurysms, they aren't as precise in determining the exact size and shape of the aneurysm. That's where other tests come into play. Computerized tomography, or a CT scan, provides a more detailed image of the aorta. It uses a combination of X-rays and computer technology to produce cross-sectional images, allowing doctors to see the exact size, shape and location of the aneurysm. This information is particularly important when planning for a potential surgical intervention. Magnetic resonance imaging, or an MRI, is another tool that can be used. An MRI uses a magnetic field and radio waves to create detailed images of the body. It's often used if a patient can't undergo a CT scan for some reason. Lastly, an angiogram may be used. This test involves injecting a dye into your bloodstream and taking X-rays as the dye travels through your aorta. This can help pinpoint the size and location of an aneurysm and can also reveal any blockages in the arteries. These tests are crucial in not only detecting an aortic aneurysm, but also in assessing its size, shape and exact location. This information is vital in determining the best course of treatment, whether that's close monitoring, medication or surgery. Early detection is key in managing aortic aneurysms and preventing severe complications. So if you fall into the risk categories we discussed earlier, regular checkups and imaging tests can be your best defense against this silent threat. An aortic aneurysm diagnosis might be daunting, but modern medicine offers effective treatment options. When faced with such a predicament, it's heartening to know that we're not alone. Medical science has made significant strides in managing and treating aortic aneurysms, ensuring that individuals can lead fulfilling lives despite their diagnosis. One of the primary approaches to managing aortic aneurysms is through medication. These drugs don't directly treat the aneurysm itself, but rather manage the risk factors that could exacerbate the condition. For instance, medicines are used to control high blood pressure, a significant risk factor for aortic aneurysms. By keeping blood pressure in check, the strain on the aortic walls is lessened, reducing the chances of an aneurysm growing or rupturing. In addition to managing risk factors, medication can also be used to slow the growth of the aneurysm. Certain types of drugs, such as beta blockers and angiotensin II receptor blockers, have been shown to slow the rate of aneurysm expansion. This can buy valuable time and potentially delay the need for surgical intervention. However, in some cases, medication alone isn't enough. When an aortic aneurysm reaches a certain size or grows rapidly, surgery becomes a necessity. There are two main types of surgery for aortic aneurysms: open repair and endovascular repair. Open repair involves removing the damaged section of the aorta and replacing it with a synthetic tube. Endovascular repair, on the other hand, is less invasive and involves inserting a stent graft inside the aorta to support the weakened wall. The choice between these two surgical methods depends on various factors, including the size and location of the aneurysm, the patient's overall health, and the surgeon's expertise. Both procedures have their own set of risks and benefits, and the decision should be made in close consultation with a healthcare provider. With the right treatment plan, patients can live a full and healthy life. Whether through medication, surgery, or a combination of both, an aortic aneurysm doesn't have to be a life sentence. With careful management and the right care, individuals can continue to lead fulfilling lives, proving that an aortic aneurysm diagnosis is not the end, but rather a new beginning. Prevention is better than cure, and this holds true for aortic aneurysms. When it comes to this silent threat, making a few key lifestyle changes can go a long way in preventing its occurrence. Firstly, maintaining a healthy weight is paramount. Excess weight puts undue pressure on the heart and arteries, which can contribute to the development of an aneurysm. Adopting a balanced diet rich in fruits, vegetables, lean proteins and whole grains can help manage weight and keep the heart healthy. Regular physical activity is also a cornerstone of weight management. A routine of moderate exercise, about 30 minutes most days of the week, can make a world of difference. Next, we cannot overstate the importance of quitting smoking. Smoking damages the aorta, the main artery from the heart, and is a leading risk factor for aortic aneurysms. By quitting smoking, you're actively reducing the risk of aneurysm development, along with a host of other health benefits. For those with high blood pressure, managing this condition is crucial. High blood pressure can weaken the walls of the aorta, making it more prone to an aneurysm. Regular monitoring and adherence to prescribed medications, along with lifestyle modifications like a low-sodium diet and stress management, can help keep blood pressure in check. It's also essential for individuals at risk, such as those with a family history of aortic aneurysms, to have regular checkups. Aneurysms often go undetected until they rupture, making preventative screening incredibly important. Regular imaging tests can catch an aneurysm early when it's most treatable. Lastly, alcohol moderation plays a role in preventing an aortic aneurysm. Regular heavy drinking can raise your blood pressure, leading to a higher risk of an aneurysm. Limiting alcohol intake to moderate levels is a powerful preventative measure. The journey to prevention isn't always easy, but it's undoubtedly worthwhile. Small changes in our daily lives can significantly reduce the risk of developing an aortic aneurysm. So let's make those changes today for a healthier tomorrow. Knowledge is power, especially when it comes to our health. The journey to wellness often starts with awareness and understanding. Aortic aneurysms, these silent threats that lurk within, can be kept at bay with the right measures. Prioritizing a healthy lifestyle is the first line of defense. Regular physical activity, balanced nutrition, maintaining a healthy weight, and avoiding tobacco use can significantly decrease your risk. But let's not stop there. Regular health checkups are absolutely vital, especially for those among us with risk factors. These checkups can help detect any potential issues early, providing a chance for timely intervention and treatment. If you suspect that you may have an aortic aneurysm, don't hesitate. Seek medical attention promptly. Remember, when it comes to your health, there's no room for uncertainty. Take charge of your health today. It's not just about adding years to your life, but also about adding life to your years. Let's make every heartbeat count. Remember, your life is worth every effort.